Welcome everyone to the Douglas Laboratories Educational Webinar Series. My name is Carla Addison Higgins and I will be hosting tonight's webinar. Our speaker tonight is Dr. Martin Gallagher, who has the unique distinction of being a chiropractor as well as a medical doctor. He is considered to be a leading authority in the field of integrative medicine. Dr. Gallagher lectures both nationally and internationally to medical professionals and the public on matters pertaining to optimal health. He is the Clinical Director of Medical Wellness Associates, a multidisciplinary integrated healthcare facility located outside of Pittsburgh, Pennsylvania. Tonight, Dr. Gallagher will be presenting on integrative protocols for joint and musculoskeletal health. The overview is that we will review the topics, the root causes of how to assess joint function in clinical practice, the integrative approaches for musculoskeletal support by incorporating diet, lifestyle, manipulation, acupuncture, regenerative injection therapy, and specific supplement regimens. We'll also review joint and musculoskeletal supplement support protocols for practice. You can send any questions that you have during the presentation through the chat button or the questions button as you see them on the bottom of your GoToWebinar box. And without further ado, I'd like to give the presentation over to Dr. Gallagher.
Thank you very much. Nice to be with you this evening. I'm Dr. Martin Gallagher, and we're going to be speaking tonight about integrative protocols for chronic pain, regeneration, how you can apply that in your practice, and how you can further help your patients along the pathway of regaining their health, improving joint function, and decreasing their chronic pain. So we have some learning objectives tonight, and that is to recognize that there's a commonality of chronic pain conditions with inflammation. Inflammation is really the big thing, the underlying factor that is related to chronic pain conditions. We're going to identify risk factors for acute and chronic inflammation and learn integrative medicine interventions to reduce pain without medication and incorporate specific protocols that you can use for your patients for back pain and autoimmune disease, osteoarthritis, migraine, rheumatoid conditions, etc., which are common protocols that I've developed practicing over decades of time using integrative medicine approaches. We need to first of all have a good understanding about how extensive pain is, not just from the things we hear in the media, but some of the cold hard facts about it. Chronic pain represents 100 million people just in the US. So it's literally every third person functioning in the United States is in some kind of chronic pain. Definitely, in terms of diabetes, 25 million people, and heart disease 16, and stroke 7 million people, and cancer 11 million people. So chronic pain really dwarfs all of these conditions. In fact, if you combine them together, it doesn't really even add up to chronic pain. So literally, if you look to the person on your right and the person on your left, you're dealing with someone that has chronic pain. The global incidence, it's estimated that 1.5 billion people worldwide suffer from chronic pain. And you hold within your hands and your head the capability of being able to transform pain so that your patients start functioning better. 3 to almost 5% of the global population suffers from neuropathic pain alone. So the pain has gone from your elbow or shoulder or knee and is centralized and being maintained in the brain and spinal cord. Not a healthy situation. So we need to understand too what the impact is, not just the impact on the patient's pain, but what about their ability to work, to function within their family life, etc. So many people suffer from ongoing problems. There's an emotional impact that takes place. So if we take a look, for instance, at the annual cost of care for pain, over $500 billion is spent in 2010 alone in the US, which combines the medical costs of pain care and the economic costs referred for disability days and lost wages. It's staggering, the incidence that this is occurring. More than half of the hospitalized patients experience pain in the last days of their lives. We know about that type of pain, people suffering from cancer and end-stage disease. 50 to 75% of patients die in moderate to severe pain, and 20% of American adults, it's 42 million people, report that the pain or physical discomfort disrupts their sleep a few nights a week or more. So we know the average American doesn't get much sleep to begin with, and compounds by the fact that they are in pain, which interferes with sleep. So the most common you're going to see in your practice, the most common that we're dealing with, we hear all kinds of things about migraine, headache, and elbow pain, and knee pain, and shoulder pain, but the reality is the number one pain is low back pain. It's the most common, almost 30%, followed by severe headache or migraine, 15%, and neck pain, and then finally facial ache or pain. Back pain is the leading cause of disability in Americans under 45 years of age. So we're not talking about people that have decrepit forms of osteoarthritis or people that are at the stage that they need a hip or a knee replaced with severe degenerative changes. We're talking about the number one reason for disability is back pain, and for people under the age of 45. So 26 million Americans between 20 and 64 experience frequent back pain. So what's the impact? Adults with low back pain are often in worse physical and mental health than people who don't have low back pain. A good reason to solve their low back pain. A good reason to understand the role of lifestyle, diet, chiropractic, acupuncture, regenerative injection therapy for decreasing this kind of pain. Almost 30% of adults with low back pain have limited activity because of chronic conditions. Contrast compared to people that don't have back pain, who can function and do the things they enjoy doing. Adults reporting low back pain are 3 times as likely to be in fair or poor health, and 4 times as likely to experience serious psychological distress as people without back pain. So think about it. Every time you go to move, bend, lift, get in and out of a car, your back hurts. You're constantly getting messages from the joints and tendons and ligaments of your back up to your brain that there's something wrong. It's difficult to be able to function like that. So how do we control pain? Well, over half of the people felt there's little or no control of their pain. 6 out of 10 people say they experience breakthrough pain 1 or more times daily, severely impacting their quality of life. So if we take a look at just things like impacts on quality of life, 2/3 of people say that their overall enjoyment of life is impaired. 3/4 of people with back pain and chronic pain are depressed. 70% say they can't concentrate. Over 70% lose their energy because of pain, and almost 90% have an inability to sleep well. So what's control over this? 6 out of 10 people say they experience breakthrough pain 1 or more times daily. More than half feel that they have little or no control. The American productivity audits found that 28,000 working adults have lost productivity because of this, just due to headache, arthritis, back pain, other conditions. Over half of the workforce had headache, back pain, or arthritis in the past 2 weeks alone. So you have not only patients coming into your offices with these conditions, people entering emergency rooms, people living on pain medications that can't function on a day-to-day basis. Headache's the most common pain condition promoting lost productivity time, followed by back pain, arthritis. So some conditions like headaches interfere with the person's ability to get to work and function properly. A big loss of productivity. So if you're an employer or you're an employee, there's issues regarding chronic pain. So musculoskeletal pain, joint pain, back pain, neck pain, headaches are going to interfere with your productivity. And lost productivity translates in the U.S. alone to $61 billion a year. Some of the surveys that have been conducted, some of the national surveys on pain, give us some idea about really what's going on with the average American. And it tells us that people are suffering from chronic pain, and it also tells us that the medical community hasn't found great ways of solving these problems. Most pain sufferers have seen their family doctor for help. 40% make an appointment with a specialist like an orthopedist, and 25% have visited a chiropractor or a doctor that specializes in pain management. So people are looking for relief. We got to give them relief. Pain medication, 43% of pain sufferers have been in pain, have been to a pain doctor. A large proportion have consulted more than one practitioner. So there's no distinction really between patients seeing specific professionals and not other professionals. Whoever can deliver the service, provide the greatest therapeutic benefit, the most cost-effective way is going to be the person, clinic, practice, organization that functions the best in this climate. We need to do this too because there's prescription drug abuse going on. We know that it's extensive. Prescription drugs are the second most abused category of drugs in the US, following marijuana. Among 12th graders, prescribed drugs used non-medically are 6 out of 10 are doing that. And over a 10-year period through 2008, the proportion of all drug abuse admissions age 12 and older reported secondary to pain relievers. So pain relievers are often abused by kids that are in grade school and kids in high school, which in turn sends them into emergency rooms or perhaps even to death. Prescription painkillers are considered the major contributor to total number of drug deaths. And in 2007, 28,000 Americans died from unintentional drug poisoning. And of those, nearly 12,000 involved prescription pain relievers. So the very thing that's supposed to give you pain relief can send you into an emergency room, send you into substance abuse, and also kill you. So among the major adjustments that chronic pain sufferers have made are such serious steps as taking disability leave from work, changing jobs, getting help with activities of daily living, and moving to a home that's easier to manage. So people lose their houses because of loss of finances. They also move because they can't walk up and down stairs. They can't lift things. They can't move furniture. There's extensive problems with drugs in the military. In 2008, the Department of Defense survey found 1 in 9 active duty service members, which is 11% of the defense, reported in the past month prescription drug misuse. The ER visits were linked to non-medical use of prescription pain relievers. They've doubled, and they continue to double again. And these are oftentimes tied into prescription opioid pain relievers, tranquilizers, sedatives, and stimulants. In terms of who gets into trouble, the adult drug abuse and admissions is extensive. 2 million people over the age of 50 use prescription type drugs non-medically in the past year. Substance abuse treatment admissions for people age 50 and older nearly doubled from 92 to 2008. It keeps climbing. Percentage of primary admissions from prescription drug abuse increased from 0.7 to 3.5% over a 16-year period of time. So how is pain relieved? The cost is $500 to $600 billion annually, which is about $2,000 for everyone living in the U.S. Trying to relieve pain. 100 million adults have common chronic pain conditions. The cost of federal and state governments of medical expenditures for pain in 2008 alone was $99 billion. So what does the CDC tell us about this? What can they tell us about how to improve the situation? They suggest that most people in chronic pain have multiple sites of pain. The majority of people have severe headaches or migraine, low back pain, neck pain, shoulder pain, hip pain. It's not limited to one area. We have extensive overuse deaths involving opioid pain relievers. In fact, they now exceed deaths involving heroin and cocaine combined. So the statistics are chilling. Prescription painkillers killed nearly 15,000 people in 2008, more than 3 times the 4,000 killed by these drugs in 1999. So we're literally getting doubling of drug-related deaths, overdose deaths associated with drugs, much of which has to do with pain management. 500,000 ER visits alone in 2009 due to misuse and abuse of prescription painkillers. At the same time, sales have quadrupled in terms of the medication use. Very common. Drugs like Vicodin are commonly taken. So we have to take a look, are there risk factors? Are there certain groups of people that are more prone to this than others? And so there's some theoretical models that one doctor looked at, Roger Fillingham at the University of Florida. And what his take on this was that psychological distress is influenced by mood, anxiety, depression, stress response, and somatizing it to the body. Tissue injury, blood pressure, impaired pain, regulatory systems, and pro-inflammatory states can contribute to high pain amplification. So we need to always think in terms of pain. Pain leads to inflammation, or inflammation leads to pain. So this is the biggest risk factor that we see really connected to all of the health professions, that people are coming to neurologists because of neuropathy, and chiropractors because of back pain, and family doctors because of migraine. But the basis of this is oftentimes chronic inflammation. So the most common type of pain is low back pain. Predictors of who's going to get it include a previous history of low back pain, psychological distress, dissatisfaction with work, lack of exercise, and lifting weights. Since inflammation is the basis of this, we need to pay attention to inflammation and how inflammation in turn can be downregulated by the type of lifestyle, diet, nutritional supplementation, exercise, manipulation, acupuncture that we can start using with our patients or continue to use in a more sophisticated way. Inflammation lies at the basis of chronic painful conditions. Lifestyle interventions are critical for chronic pain, and identifying the traditional and non-traditional risk factors in the population and modifying those risk factors is the key to successful outcomes. We need only to take a look at some of the major medical journals, as well as magazines like Time magazine. They had a front cover of inflammation, the silent killer. So there's a link between chronic pain, arthritis, cancer, heart disease, memory loss, degenerative disease, and obesity. The basis of this is inflammation. So what are some of the triggers? Some of the triggers that we work with in my office, some of the triggers that people are working with in the various medical communities that are addressing inflammation from an integrative standpoint is, one, the American diet. If you eat the American diet, you're going to inflame your body. So the white flour, white sugar, high in dairy products, high in gluten products are huge triggers for inflammation, both the type that lead to pain, chronic pain, autoimmune disease, osteoarthritis, and a wide variety of inflammatory conditions. And of course, you can also be eating a good diet and have trauma or mechanical stress or pain. This is the basis of treatments such as chiropractic and acupuncture and prolotherapy. Obesity and diabetes and coronary artery disease, those are triggers of inflammation. So obesity cells in turn release cytokines that are picked up in the brain, and the brain upregulates inflammation, interleukins that in turn drive inflammation so that you do something about taking care of your body. You can have genetic factors and polymorphisms. You don't metabolize B12 or folate properly. You may in turn be susceptible genetically to inflammation. You can be eating foods you're allergic to. We pay a lot of attention at our office to food allergies. So you want to take a look at delayed testing on foods like IgG testing. So a person, for instance, could eat eggs and develop arthritic pain. Another person could consume dairy products and have shoulder or elbow pain. Another person could be consuming soy products and in turn develop irritable bowel syndrome and referred pain in the low back. Because of the extensive toxicity of the environment, food, water, and air, toxins and heavy metals like lead, arsenic, mercury, tin, and aluminum are many times contributing factors to chronic pain or the cause of chronic pain. It's not just Flint, Michigan that has lead in the water. 70 to 80% of the amount of lead that's found in Flint water is found in Pittsburgh water, where I live. So there's lots of lead in the environment. That alone is a big contributing factor. You can have gut dysbiosis, small intestinal bacterial overgrowth, maldigestion, absorption. You for sure want to pay attention to the gut-brain pain relationship. It is gigantic. So this is where we want to deal with diet, supplementation, mega probiotics, gut repair factors, and then of course for your joints, things like glucosamine, curcumin, ginger, etc. As you age, women go through a change of life. Guess what? So does every man. So men and women both go through change of life. This is where hormone support, either herbal hormone support or bioidentical hormone replacement therapy, plays an important role. Think about inflammation and pain like your patient comes with shoulder pain, knee pain, neck pain, back pain, or generalized pain. And then take a look at the profile of the person. You're a 56-year-old female, you stopped your periods 2 years ago, you have osteopenia or osteoporosis. That basically means that you've lost 30 to 60% of the density of your bone. Now, if you lost 30 to 60% of the density of your bone, guess what attaches to the bone? All of your soft tissue. So tendons and ligaments become laxed. This is the basis then of bursitis, tendonitis, shoulder pain, chronic back pain. This breakdown of the tissue is a byproduct as you age of hormonal depletion. So men and women need bioidentical hormone replacement therapy. And of course, we don't want to underplay the importance of regular exercise, tonifying your muscles and tendons, turning on your cardiovascular system, and getting yourself to sleep at night, meaning going to bed around the same time, getting up around the same time. Eating cyclically as well, meaning eating breakfast, lunch, and dinner, or lunch and dinner, and not eating in between, not eating late at night. So what are some of the causes of pain? Well, it's multifactorial. You know, oftentimes in conventional medical systems, they're looking for the one trigger that's causing pain. So they're looking to isolate a bacteria like chlamydia associated with conditions like chronic Crohn's disease, or with joint pain like rheumatoid conditions. But oftentimes what we're dealing with is multifactorial triggers lead to inflammation, like having stress without distress, having structural stressors like your spine is out of alignment, your muscles are loose and weak. You have reflexes like your organs are malfunctioning, like your kidney or your stomach, and it's referring pain back into your back, or your back's out of alignment, and in turn leading to organic problems like hiatal hernia, or stomach pain, or IBS, or irregular periods. You may have functional endocrine disturbances. You may have low adrenal function, quite common, and that can trigger inflammation. Remember, the adrenal makes cortisol, DHEA. So if things aren't working so good, you're going to become inflamed. You have to have proper support for your adrenals, your pancreas, your liver, etc. You can be nutritionally deficient. So just lacking nutrients, lacking things like magnesium will cause muscle spasm and pain. Lacking omega-3 fatty acids and eating a diet that's high in omega-6 and 9s is going to inflame your body. Not having enough spices like ginger and curcumin is going to make your body more prone to inflammation. Lacking B vitamins, especially pantothenic acid, means you won't make enough cortisol. So nutrients and nutrient deficiencies play a role in as well. You could be like the average American with the ABCs, taking antibiotics. You had a sinus infection or sore throat. You took an antibiotic. Women taking birth control pills. Men, women, and children having prednisone or cortisone nasal sprays. People eating the American diet laced with sugar. These are called the ABCs. These are triggers to put the body into small intestinal bacterial overgrowth, or fungal or mycobacterium stressors that in turn live in the gut that then generate pain. This is the gut-brain pain relationship. Food and environmental and chemical sensitivities, toxic overload, and lack of exercise. So regardless of your method of practice, pain is the primary reason why most patients consult physicians. So you can measure the inflammation, right? You can do history and physical pain scales, range of motion x-rays, but you also need to evaluate the role of nutrition and lifestyle. The majority of diseases are related to inflammation. So you have to downregulate the inflammation by eating an anti-inflammatory diet, taking nutrients that decrease inflammation and promote regeneration. It's intricately simple and simply intricate. Test the patient for food allergies. We do IgG food allergy testing, delayed reactions to foods. We test toxic metals like lead, mercury, aluminum. Even people going and having MRIs of their neck and back are getting a contrast dye, and that contrast dye, gadolinium, guess what it shows up when we do chelation challenge tests? We see gadolinium, which is supposed to be absorbed after 72 hours and excreted out of the system. We find it 5 and 10 years later. A neurotoxin, a neuroinflammatory agent. So test your patients for toxic metals like lead, mercury, and aluminum. Check their hair analysis for mineral imbalances. Make sure to run the inflammatory markers like C-reactive protein, sedimentation rates, cytokine testing, insulin and homocysteine, and genomic testing, like particularly MTHFR. You know, we want to make sure, can they detoxify? So digestive stool analysis is one way you can do this. You're going to look at the gut-brain pain connection. So evaluate the stool. Is the patient digesting, absorbing, and eliminating? Do they have parasites or fungal disorder? Do they have an overgrowth of unhealthy bacteria? Check the MTHFR. That can be done through saliva, or it can be done through blood. A lot of people have the failure to methylate, failure to detoxify, so their chronic pain, allergies, mental illness, migraine is being caused by the fact that they cannot detoxify. So you have to have things like methylfolate, methyl B12, sulfur compounds that we're going to speak about, glutathione. We need a new model. The model that's currently in place in medicine obviously isn't working. We have a drug-addicted society that keeps going back for more drugs. We have overdose deaths. We have millions of people entering emergency rooms and doctors' offices with no solution other than to throw more drugs at it. We need a new model. That's the integrative medicine model. Structurally, that model is chiropractic, regenerative injection therapy, acupuncture, physical therapy, and exercise. There's a chemical component. That's why we have Triad of Health. Nutritional, herbal, homeopathic, intravenous vitamins, and detoxification. Emotional, things like cognitive behavioral therapy and eye movement desensitization, and in the chiropractic field, neuroemotional technique. Spiritually, teach your patients, or you learn personally how to do meditation, prayer, mindfulness training. All these help to down-regulate pain and inflammation, decrease the need for medication, and help the patient self-regulate to start to get well. When we specifically focus on structure and function, we need to think about loss of joint mobility. Like people say to me, well, when do you need chiropractic versus when you need acupuncture versus when you need regenerative injection therapy versus when you need to have surgery? Well, think of it this way. Joints are supposed to be freely movable. If they lose their mobility, like you can't turn your head from side to side, you can't touch your toes, you can't twist without hurting, that's loss of joint mobility. That requires chiropractic manipulation and then the nutritional support factors to help to support the adjustments and realignment. But on the other hand, if you're overly mobile, we call that chronic joint laxity, looseness, like having loose teeth. This requires a different form of structural care. This is regenerative injection therapy. This is where prolotherapy, PRP, ozone, stem cell injections play a very important role. So for our patients at Medical Wellness Associates, we use chiropractic manipulation, nutritional therapies to downregulate inflammation. If there's laxity, we use regenerative injection therapy to get the soft tissue growing back on the bone again. Trigger points, acupuncture, massage, and Graston, great ways of downregulating pain. And loss of strength, exercise, PT, yoga, Tai Chi, that can all be part of your prescription. Think in terms of a protocol for musculoskeletal health. Remove your food allergens. We discussed about the importance of testing. Short term, I've used a 10-day detoxification diet in my office for decades. This is 10 days of fruits and vegetables. Long term, put the patient on an anti-inflammatory diet, which means the removal of allergenic foods and eating foods where there's fresh, raw, preferably organic fruits and vegetables, raw nuts and seeds, lean organic meats, grass-fed meats, oils such as coconut oil and flaxseed oil, much better choice. Make sure you supplement your patient's diet. These are people with chronic pain, osteoarthritis, disc herniation, migraine headache, chronic back pain, shoulder rotator cuff tears. Supplement their diet with nutrients that downregulate inflammation and promote repair. Curcumin, quercetin, omega-3 fatty acids, solubilized keratin. Keratin was ineffective in the past until the technology has allowed it to be solubilized. So you can now take this in capsule form or powder form to fix the problem. Boswellia, so things like Ayurvedic frankincense, has big anti-inflammatory effects. MSM, because of the sulfur compounds, promotes detoxification, helps joints to glide better, move more freely, less stickiness in the joint. You can consider using pterostilbene, especially methylated resveratrol, promoting increased circulation and decreased inflammation. And of course, D3, K2, and minerals. Remember, D3 and K2 work together to take calcium out of the blood and put it into the bone. Very important, particularly as we age, because as you age, calcium comes out of the bone and into the soft tissue and into the blood. Consider for your protocol chiropractic or osteopathic manipulation, medical acupuncture, and exercise. Incorporate these techniques. Use regenerative injection therapy. This is our go-to for things like herniated disc, torn rotator cuffs, meniscal tears, chronic recurring arthritic problems. It's rather remarkable. Autoimmune diseases like rheumatoid and lupus consider low-dose naltrexone and minocycline. So these are the medication part of our program when indicated. Low-dose naltrexone helps to markedly enhance immune function, so it helps with the autoimmune part. So if you find like you're doing the diet change and the supplementation and chiropractic and relaxation and acupuncture and you're still hitting a brick wall, some of these are autoimmune and require more of a holistic approach using naltrexone, usually 3.5 to 4.5 milligrams before going to bed. Diets with low glycemic index, high in antioxidants. So you want to eat foods that are high in fiber, phytonutrients, fermented foods like sauerkraut and kimchi. Eat a paleo diet or Mediterranean diet. Mediterranean diet is rather remarkable. They found in studies there were 3 arms to the heart disease and also to the dementia study of the Mediterranean diet. And they found that the Mediterranean diet, the one arm was the regular Mediterranean diet compared to low fat, compared to high fat. The Mediterranean diet with the highest amount of fat, people had the greatest success with heart disease and dementia. So make sure fats are part of your diet. Do intermittent fasting. Stop processed foods or minimize them. Go gluten, dairy, and sugar-free whenever possible. Now, I mentioned before to regenerate tissue, solubilized keratin is very important. This wasn't able to be done until the past several years, but it's been shown to increase joint mobility and decrease joint discomfort. In fact, studies have shown that there's an improved WOMAC score of joint pain and stiffness in physical activity based on human trials. You can reduce pain and raw stiffness 2 times that of placebo by 30 and 60 days. So place your patients on solubilized keratin. Have them take a couple capsules twice a day, and you may find in 30 to 60 days that they have less joint pain and more mobility. And also you can remeasure your marker. So you may see that C-reactive protein and sedimentation rate decreases, which tells you that you're decreasing the inflammation. Use nutrients like boswellia. This is standardized AKBA. This enhances the absorption of it. This works on 5-LOX and MMP3, which downregulates inflammation and improves the integrity of connective tissue. Some people are using this in dropper form, like frankincense, for the people that are using the oils. But I find the capsules are extremely beneficial, and they also have the standardized AKBA, very important. And 2 clinical studies have found that osteoarthritis, they knew that 100 milligrams of boswellia improves significantly the pain and functionality of people that have had chronic knee osteoarthritis. Use regenerative nutrient therapies like carnosine, green tea, blueberry, and D3. It's been studied in vitro for its ability to support the bone marrow and other stem cell proliferative activity. So it can help to launch your stem cells, help you with recovery. Vitamin C, it oftentimes is kind of pushed aside until you start hearing about high doses of vitamin C intravenously. But it helps to modulate mesenchymal stem cells and improve their proliferation. This is really important when you're trying to build collagen and try to repair your patient's shoulder problems and bursitis in their elbow and chronic knee osteoarthritis. It's hard to do it unless you've got the goods to do it. You can't make cement without having the proper ingredients. Pterostilbene, like methylated resveratrol, it supports healthy apoptosis. So you're going to knock off those factors that contribute to impairing you with pain, and also helps to promote the migration of stem cells to tissue. And I mentioned vitamin K2 and D3. They stimulate bone MSCs, so you're getting more mesenchymal cell stimulation so that you've got more enhancement and attachment at your soft tissues. Consider
Gallagher?
Yes.
Okay. Can you, with these smaller slides, can you switch this to presentation mode so that the viewers can follow along, just seeing the individual slides one by one? If you go to the bottom left-hand corner to the, yeah.
Yep. Are we good like that?
Yeah, or the presentation mode, whichever you choose.
Okay.
Thank you.
Yep. Regenerative nutrient therapy, glucosamine, chondroitin, or MSM. We all know about those. These are very important. The reason being, it's biologically active sulfur. So you can't make your glycosaminoglycans without sulfur. So this is why you always want to eat onion and garlic, good sources of sulfur. Take the supplements, glucosamine, chondroitin, or MSM. We in our office also use MSM intravenously, as well as DMSO intravenously. DMSO intravenously also helps to make MSM in the tissues. Very important for people with arthritis and arthritic pain. Consider the amino acids, arginine, proline, and glycine, and manganese to support collagen synthesis and ligament strengthening. So you want to tighten up the ligaments. Remember, if you have patients and you're treating with trigger points, like trigger point therapy with acupuncture, trigger point injections with homeopathic remedies, these trigger points in the muscles form because the ligaments are loose. The muscles are rarely the cause of the problem. Underlying this are weak ligament structures. So support your ligament structures by the things I just mentioned, and consider regenerative injection therapy. Remember the importance of vitamin D. It's not just the sunshine vitamin, or not just for the prevention of flu. Fibromyalgia, common things that people are seeing in their offices. It's linked to vitamin D deficiency. So their patients randomized to 50,000 units of D3 or placebo for 8 weeks. And compared to the participants in the placebo group, patients in the treatment group showed mild short-term improvement in overall fibromyalgia impact score. So yes, D3 should be part of your picture. I frequently recommend 5,000 units of D3 a day for patients, including the summertime. Some people 10,000 units as well. Most adults, the sweet spot seems to be between 5 and 10,000, and try to get your blood levels up to 60 or greater. Omega-3 fatty acids, they're involved with the proper structure and function of the body systems. Think about your brain. Your brain's literally 70% fats. So you have to have healthy fats being put back into your brain and body. Your cell membranes are composed of these. And if you don't have enough of that, and your body switches to junk food and junk fats, you're going to get more omega-6s and 9s. You're going to promote inflammation. So you're going to get things like inflammatory compounds derived from arachidonic acid going into the inflammation panel. So you want to get your blood levels of DHA and EPA up. The type of fish oil that we use in the office, the omega-3s, is the reesterified triglyceride form. This is a higher absorbable form and also free of toxic metals. So here's our omega-3 supplement protocol. Chronic inflammation, 2 to 12 grams per day, 2 to 12,000 milligrams daily. Autoimmune back pain, DJD. So you have a lot of patients with rheumatoid arthritis, lupus, scleroderma. These patients oftentimes need 4 to 12 grams daily. You have patients who are depressed and anxious and insomnia. Sometimes a depression which is being treated with anti-anxiety drugs and antidepressant drugs oftentimes is due to something as simple as not eating enough fish or not having enough DHA in the body, so your brain's chronically inflamed. So brain inflammation leads to depression, anxiety, mood swings, agitation. Bipolar disorders are exacerbated by bad diet. With coronary artery disease, we hear about how bad fat is. No, bad fat is great for us. We need natural fats, and 4 to 6,000 milligrams a day of omega-3s. And if you're a Crohn's or ulcerative colitis patient, consider irritable bowel disease getting at least 2 grams or higher as part of your protocol. Curcumin, It's the buzzword in the healthcare community for good reason. It's the common Indian spice found in turmeric. It is a COX-2 and LOX and NOX inhibitor. This is gigantic, meaning that it's multifunctional, it's a safe agent, it's anti-inflammatory, antiviral, anti-tumor properties. We use it at our office on a daily basis. The majority of our patients are taking either free-form curcumin or turmeric. We also use it intravenously, so we drip into the system free-form curcumin to patients with chronic inflammation, digestive diseases, cancer, and other disorders. So what about the curcumin? You want to make it bioavailable. Here's the deal on curcumin. When you take curcumin, the majority of the curcumin goes from the digestive system to your liver. First pass in the liver. In the liver, it has to get glucuronidated. That's just the way it works. And as a result of that, the majority of the free curcumins don't release out in the bloodstream. Of course, there's an effect because curcumin of any type and turmeric of any type decreases inflammation. But the current technology, sort of like the technology in cell phones, is to take the curcumin and put it into a phospholipid matrix. So there are certain types that have ratios of lipids, phospholipids. So it, in turn, this fat-soluble entity is absorbed in the lymphatic system. It bypasses the liver, and in fact, this has been measured. There's free curcumin levels found in the brain, and the brain is permeable to this. So you want to go mouth to gut to lymphatic system to crossing the blood-brain barrier and into the brain. So this type of curcumin, which is about 65 times more bioavailable. So this is referred to as the free forms of curcumin. Curcumin trial with biomarkers, 30-day trial at Ohio State. This is a pretty significant study. 400 milligrams of solid lipid curcumin in healthy middle-aged adults decreased the inflammatory markers, decreased circulating amyloid beta. What's that linked to? Alzheimer's disease, dementia. Increases vascular function, increases nitric oxide, lowers triglycerides, and improves total antioxidant status. Not too many things do that. Curcumin, rheumatoid arthritis, and pain meds. This is a real big thing. 45 subjects with active RA treated with curcumin compared to a big NSAID, diclofenac. It's a prescription drug that a lot of doctors prescribe. And the author's conclusion, curcumin may be more effective than the drug diclofenac with patients with active rheumatoid arthritis. I certainly have found this to be the case in my practice, but keep one thing in mind: when you take curcumin, curcumin does not work immediately for most people's pain. They have to be maintained on pain medication, then weaned off as you get the anti-inflammatory effect for the curcumin, which is sometimes delayed 2, 4, 6, or 8 weeks. So for your skeletal bone supplement protocol, why should you do this? Because the majority of people that you see have back pain, the leading cause of disability, shoulder pain, knee pain, tendonitis, bursitis. This is the drugless prescription you want to go with. Vitamin D3, 2 to 5,000 units. Some of my adults are 10,000 units. Vitamin K2. D3 and K2 work together synergistically. They take calcium out of the blood, put it into the bone. End of story. That's a huge thing. You want to support all the osteoarthritis conditions with additional factors like magnesium and phosphorus and zinc and boron. And of course, remember MBP, the milk protein fractions. They help to improve the relationship between the osteoclast and the osteoclast to help to strengthen the bone, as opposed to drugs that are constantly interfering with the buildup and breakdown of the bone. You want to have that buildup and breakdown go smoothly, and that's where the drugless prescriptions come in. So think about repairing your joint cartilage when you see people walk around, difficult walking up and down stairs, standing one position. They've stopped dancing, they've stopped working in the garden, they've stopped going to the gym, they've stopped doing all these activities because they hurt so much. You need to think in terms of structurally aligning them, giving them acupuncture, Graston technique, chiropractic treatment, regenerative injection therapy, IV vitamin therapy, change their diet, and give them the nutrients to repair their cartilage like glucosamine, chondroitin, or MSM, sulfur-based, at least 1,500 milligrams. Use UC2 cartilage from chicken, at least 40 milligrams a day. What happens is your body, particularly with autoimmune disease, will attack your, which is normally attacking your cartilage, will start attacking the chicken collagen. That's a great thing. Hyaluronic acid, we use this extensively for joint stiffness. We use it orally, and we inject it in joints. Fish oil, at least 1 to 2 grams a day or more. Joint discomfort, curcumin, 400 milligrams a day. So you want to move better. You want to be able to play tennis or golf. You want to do it with less pain. You want to do it with less drugs. This is the way to do it. Free-form curcumin, solubilized keratin, boswellia, at least 100 milligrams a day. Make sure you have the AKBA, otherwise you're spinning your wheels with boswellia. We also use it extensively for respiratory diseases, including asthma and COPD. Fish oil with the higher EPA ratios, 2 grams daily, and systemic enzyme therapy. So this is where things like wobenzyme, pancreatic enzymes, bromine and papain, taken on an empty stomach for inflammation is very helpful. If your patient's not digesting or absorbing their food properly, have them take it after their meals, like 3 or 4 capsules of wobenzyme, or do that and take it in between as a natural anti-inflammatory. Think about joint regeneration therapy to enhance ligament and tissue growth and repair, stem cell proliferation and migration. So you want to get your bone marrow and other cells of your body kicking in. Recently, it's been found that stem cells are produced in your lung, not just in your bone marrow. So we're going to find out there's multiple sites for stem cell production, and you can help to launch these to promote tissue repair by taking solubilized keratin, at least 500 milligrams a day. Take boswellia, at least 100 milligrams a day. Take the amino acids that we talked about, arginine, proline, glycine, carnosine. Add MSM into the picture, either in capsules or powdered form. Vitamin C, 4,000 to 6,000 milligrams a day. K2 and D3 to bind the excessive calcium in your blood and put it in your bone. It also prevents heart disease. And take Terral Stilbene, green tea, and blueberry, which helps to launch more of your stem cells, and you want to get that working on your behalf. So now we've covered lots of things. We've looked at the role of diet, anti-inflammatory diet. We've looked at the importance of detoxification. We talked about the importance of joint regeneration and making joints more comfortable and less painful with things like keratin, boswellia, free-form curcumin, amino acids, MSM, vitamin C, glucosamine chondroitin, boswellia. These are all important natural drugless anti-inflammatory agents. They even beat drugs like NSAID drugs when they're taken over a period of time. So get your patient down-regulated inflammation, get them more mobile with chiropractic manipulation, acupuncture, stretching exercises, yoga, and certainly consider oral and IV nutritional therapy as part of the mix. This is called integrative medicine. I'm board certified in integrative medicine. I'm a family medicine doctor. I'm also a chiropractor, and I teach at 2 medical schools, University of Wisconsin as well as West Virginia University. We're training our residents as we speak in integrative medicine as well as family medicine. This is not the wave of the future. This is the wave of now. So get on board and become part of the solution. If we have any questions, I'll be happy to take them. This is my contact information, Dr. Martin Gallagher. I've left my Gmail address as well as website information if you'd like additional information. We have painful references as well, and some additional painful references for your evening enjoyment. Questions?